Pioglitazone after ischemic stroke or transient ischemic attack. Background: patients with ischemic stroke or transient ischemic attack or TIA are at increased risk for future cardiovascular events despite current preventive therapies. The identification of insulin resistance as a risk factor for stroke or myocardial infarction raises the possibility that pioglitazone, which improves insulin sensitivity, might benefit patients with cerebrovascular disease. Ischemic stroke, or TIA, is when flow to part of the brain stops for a short period of time. TIA is caused by a clot, but the blockage is temporary. Symptoms occur rapidly and last a relatively short time. Eventually, all clots will dissolve, but whether there is damage depends on how long the clot is in place. Method: it was randomly assigned patients who had had a recent ischemic stroke to receive either pioglitazone or placebo. Eligible patients did not have diabetes but were found to have insulin resistance. Pioglitazone is a prescription drug with hypoglycemic action to treat diabetes. While pioglitazone does decrease blood sugar levels, studies on the main cardiovascular outcomes have not yielded statistically significant results. It can cause or worsen congestive heart failure. Results: in patients in the pioglitazone group and in the placebo group, diabetes developed in 73 patients and 149 patients respectively. There was no significant between-group difference in all-cause mortality. Pioglitazone was associated with greater frequency of weight gain than was placebo, edema, and bone fracture requiring surgery or hospitalization. The conclusion: in this trial involving patients without diabetes who had insulin resistance along with a recent history of ischemic stroke, the risk of stroke or myocardial infarction was lower among patients who received pioglitazone than among those who received placebo. Pioglitazone was also associated with a lower risk of diabetes but with higher risk of weight gain, edema, and fracture.